Good morning, everyone. I'm Dennis Richardson, Oregon Secretary of State, and I'm here with our Manager and Chief Auditor for the Audit of Child Welfare, Jamie Rawls, and we are conducting this press conference to announce the release of a very important audit, and it will help set the stage for major changes, revisions, and improvement, hopefully, with our foster care system. I mean, the time for talk is past and the time for action is now. And this is something that's really personal to me. 27 years ago, my wife and I were certified as foster parents, and we adopted a 10-year-old girl from the foster care system, and it took many visits of foster care workers to come to our house, hours and hours of time, and 9 months before we could be involved with having this Mary become our 8th daughter, and she was part of the foster care system. It was a problem back then, and the problem is much worse now. To help you understand the nature of the findings from this audit and the situation that we're confronted with now, when we have 11,000 children involved in the foster care system, I would turn the time over to Jamie. I then will have a few closing remarks, and then we'll take your questions. And today's questions will relate solely to this audit and the foster care system. Jamie.
Good morning, and thank you for joining us today. As the Secretary said, my name's Jamie Rawls. I'm an audit manager with the Secretary of State. I also wanted to introduce the rest of the audit team, which is the Audits Director, Kip Mimmet, Deputy Director, Will Garber, and staff auditors, Bonnie Crawford and Lisa Durden. I will be presenting a brief summary of the findings of the audit and highlighting key points, and then we will open it up for questions. Our audit includes 3 findings that are logically and functionally related and serve to reinforce each other. We first highlight management failures that have persisted over time and across programs. We then describe the problems with foster parent recruitment and retention. And last, we end with inadequate staffing. Over 11,000 children are entering the Oregon foster care system every year. These children are one of the most vulnerable populations in our state. The supply of suitable foster homes and treatment facilities for these children is falling, leaving children entering foster care with increasing limited placement options that are sometimes inappropriate and unsafe. Since 2011, the number of available foster homes has declined 15%, and the total number of homes with foster parents who are not related to the children has declined by almost half. These career foster parents are the backbone of the system, and their decline is a substantial problem. They serve more children for longer average time spans, they receive more training, and care for a wider variety of children, including those with special needs. The foster parents who serve these vulnerable children are struggling. Foster parents told us they do not feel adequately supported by DHS in dealing with the challenges of children in their care. And at the same time, the agency is asking foster parents to take on more duties as caseworkers struggle to manage their caseloads, and to take on more children as the supply of homes dwindles. The agency has also increasingly resorted to housing children in hotels, often leaving inexperienced caseworkers who work full-time schedules during the day to supervise them during the night. From September 2016 to July 2017, DHS has placed 189 children in hotels at least 284 times. The average length of stay was 7 days. Several of these instances involved the same child being placed in a hotel multiple times. One child was placed in a hotel 9 separate times in a 14-month period. DHS did not formally track the hoteling of children until September 2016, only after a federal lawsuit was filed. We found the data that they were tracking was not always complete or consistent or reliable, and we were unable to conclude on behavioral needs of children who stayed in hotels, as over 60% of them did not have a record of a behavioral assessment. We also found the agency is not tracking costs. We estimated the cost from September to 2016 to July 2017 to be over $2.5 million. Foster children and families are served by caseworkers who are doing the very best they can with limited resources. Child welfare offices are chronically understaffed, and they are currently short approximately 770 caseworkers, supervisors, program managers, and support staff who are all needed to manage caseloads. Caseworkers are overworked. They're struggling, and many are leaving the department in high numbers. Caseworkers are not able to have meaningful visits with children under their supervision even once a month, the bare minimum. Caseworkers are overwhelmed with high caseloads, which have led to rampant overtime use, high turnover, and frequent use of medical leave for stress and burnout. In one office, we visited 8 caseworkers in a single unit were out that month on stress-related medical leave. This means that their caseloads have to be transferred to the remaining staff who already have full caseloads. We shadowed many caseworkers during the course of the audit and found the work emotional, exhausting, and heart-wrenching. As a result of the turnover, over a third of the child welfare staff are in their first 18 months on the job. Many of these are getting full caseloads before they've even completed full training. DHS spends an estimated $28 million per year on training and onboarding new caseworkers, due in part to the large turnover. In light of these severe issues, we found management's response to these problems has been slow, indecisive, and inadequate. DHS and child welfare managers have not strategically addressed severe and chronic caseworker understaffing. They have failed to provide the legislature with accurate staffing data for funding and decision-making. They have not strategically addressed the recruitment and retention of high-quality foster parents, and they have not developed a statewide recruitment strategy, instead relying on a piecemeal outsourcing of recruitment that misses much of the state. For over a decade, management's response to the crisis and scrutiny has been to reorganize the system, not effectively plan to fix it. Several substantial reform efforts have been poorly planned and executed, then abandoned. This lack of strategic management has helped fuel an increase in lawsuits and legal payouts totaling $39 million since 2006. Management problems are widespread. We found managers unwilling to take responsibility for key decisions and results. On multiple occasions, staff told us they felt unsafe or uncomfortable with raising concerns to management about critical child welfare issues. Management also oversaw installation of a faulty case management system, ORCIDS. It leaves managers and caseworkers with inadequate information. ORCIDS has been problematic from the beginning and ended in a mutual termination agreement with the vendor. It cost the state $74 million, and there are still over 1,000 fixes and defects waiting to be addressed. During the audit, caseworkers reported this as the single biggest barrier to practicing timely case management. Management is not confident in the integrity of the data coming out from ORCIDS, but has not yet moved to overhaul or replace the system. To begin reversing the growing foster care crisis, we concluded DHS must first address its management and its organizational culture deficiencies. Our 24 recommendations provide a pathway for DHS to shift to strategic management that more effectively serves the vulnerable children in its care. DHS and the Office of Child Welfare have recently taken on new leadership. This leadership has accepted and agreed with all of our findings and recommendations. They have been working to address some of the problems while the audit was in progress, and we are hopeful we will continue to see positive changes. We welcome any questions.
Before we do that, I want to mention just a couple other things. The thousands of children in Oregon's foster care system are among the most vulnerable population in the state. These children need secure and appropriate placements with well-supported foster families. The problems facing Oregon's foster care are serious and demand thoughtful and immediate consideration. And today, when we cannot ensure that foster children are receiving adequate care and services, state leaders are truly alarmed with this deplorable situation. As a shout out to Governor Brown, just a few months ago, she brought in a new DHS director, Verboers Paksarish, who is determined and dedicated to make a difference and to change this system. He brought in Marilyn Jones, a very experienced woman who was the director of the Baker region. She had been successful in business, moved to Baker, volunteered her time in this important area, and then ultimately became a worker and the director of that division. She is determined to make a difference. The two of them presently are going around to all 16 of the district offices, which hasn't happened before. One of the things that the auditors found when they asked the members of these, the caseworkers and leaders in these district offices, when the last time was that you saw a central agency leader come out here, they said many times, we've never had that. So they're going out and they're saying, we're going to make a difference. And they're telling caseworkers who are ready to leave, please don't leave now. Give us a chance to make a difference. And so that is a very positive move. And when we look at this audit, it's with the understanding that it is a baseline for new leadership, so that we know where things are at. We're not here to blame the new leadership, but to support them in the changes that they're going to make to help things be better. So, as I mentioned, the time for action is now. New leadership team at DHS is ready and willing to support their caseworkers with the time and resources they need to do their job. So, with that, do you have any questions? Anything that we can help answer to help you do your job to inform the people of this need?
I'd ask Secretary Richardson, with nearly 800 fewer employees than would be optimal on cases, and caseworkers, it sounds like handling like 3 times the optimal load. How has this managed to happen? Been going on for so long. How has this managed to continue?
I have my personal opinion and my official one. I'll give you both. My personal opinion is that there is not a strong enough lobby for the children when it comes to allocation of services. And having been co-chair of Ways and Means, I understand that you have to have enough votes to pass budgets, and so sometimes priorities are not necessarily set by the greatest need. The official answer is that we're here to reveal the current situation, and it's up to the legislature and the governor's office to analyze the results of the audit and make the determination of what's necessary for this situation to be changed. We can mention that in the research of other states and what's gone on, Texas, for instance, they had a similar situation. Their leadership said, we're not going to tolerate this any longer. They hired over 800 new caseworkers and reorganized their system and gave them the tools to focus on the most vulnerable population in their state, their children. And we need that same kind of action and dedication here in Oregon.
In terms of the numbers of caseworkers, is it a matter of needing more money from the legislature to do it, or are there efficiencies within the system that you found too that could be made to save money, to hire more?
Why don't you answer about that?
There's definitely efficiencies that could be made. Just the pure turnover that's happening and the churn of caseworkers is costing money. If they could get caseworkers in, adequately train them, and they could stay, they're going to save money right there on the onboarding and training constantly of these caseworkers. They're going to see it in the end. We also found, a lot of the other states that have had to invest in staffing has been sued. And, that's something that's scary here for Oregon as well. But there's a lot of efficiencies if they had to look into it, that they're contracting out or they're doing different work that they don't have enough work to do in-house, and if they were able to get enough staff, they could start doing that and find efficiencies on the end.
We would ask everyone to read this report. It's written for the people, and it's written for the people's elected representatives, because you'll read about situations, you'll read about what individuals are doing to try and make a difference. There's a woman in Roseburg area who can't foster anymore, but she's opened up a room in her house, and she goes out and solicits and collects food and clothing items and school items so that foster parents can come and have access to additional things that they need to help become better foster parents. There is respite care for foster workers that individuals can do. We would hope that citizens might consider, we can't take in a child, but we can help over a weekend. There's so much that can be done at every level. I'll be sending out a newsletter by Friday of this week laying out the importance of understanding where we're at and what can be done, because this is a statewide problem. This isn't a problem for the governor to fix. It's not a problem for the legislature just to fix. It's our problem. These are our children. And it's important that we take responsibility to not allow this to continue.
Jamie, you said 11,000 children enter the foster care system every year. You know, I'm far from an expert. I know very little about it, but that seems like a huge number. What do you attribute that large number to?
We had heard varying reports of the field offices that we visited. Southern Oregon has an opioid crisis statewide, and there's opioid crisis, and they DHS is not tracking the data that they need to be able to determine that. If they were looking at the numbers coming in of babies, for instances, we talked to a judge down in the Southern Oregon area that said he had studied the numbers of children, babies coming in addicted to opioids, and had found it alarmingly increased. And so if you start studying the statistics of who's coming in and what makes up the characteristic of those children coming in, you could get some more answers, but DHS doesn't currently have that data. And
has that number, 11,000 per year, is that pretty steady, or is that increased?
It's stayed pretty steady over the last couple years. It's been right at 11,000. So we haven't seen a huge spike of children coming into the foster care program, but we have seen a significant decline in foster homes.
That's really important to focus on. When you lose 55% of your experienced foster homes, and yet you still maintain the same number of kids, it's not an option that these kids be taken and given a place. They have to go somewhere, and so when you don't have the homes, that's when you end up in hotels with foster care workers who've worked all day now having to be up all night, 2 foster care workers for an individual child that may be in this hotel, and then they can't be with their own families. I mean, it's a heart-wrenching situation when you hear a foster care worker who, a caseworker who was talking with the auditors and saying, I have a 4-year-old child who cries when I leave because she wants to see her mommy, and they can't give up on the kids that they serve, but they also have their own family. I was called several months ago personally by a woman, 26 years in the foster care system as a caseworker supervisor. She said, I'm retiring, not because I don't love my job and I feel bad because I'm letting my caseworkers down by leaving, but I can't tolerate the stress anymore of having a requirement that I can't meet. It is beyond my capacity and my caseworkers' capacity to meet the needs of these kids without help.
How many kids leave, like, you know, get old enough, like they leave the system, just to get an idea, and how many are currently roughly in the foster care system in Oregon now?
There's various numbers. So the 11,000 is per year, 11,000 kids per year. They also have a 7,600 number, and those are the, you know, on any given day, there's 7,600 kids in the foster care system. And then there's also further numbers of the ins and outs and the churn, and I don't have that handy, but I could get it for you, and I think we talk about it in our audit.
Can you clarify what you just said? And maybe I'm slow on math, I apologize. But so there are 11,000 new foster kids in here every year, or 11,000 total in the foster care?
Over a course of a year,
Yes.
there's 11 that are in and out, and it's the general daily average is about 7,600.
Yes, on any given day, there may be 7,600 kids in the foster care system.
Thank you.
Other questions?
I have a bunch of questions, but people could feel free to interrupt.
Go ahead and shoot.
You talked about changes in the system. Is this audit report up to date as far, talking about the current system, current situation? Have there been a lot of, you talked about some improvements since September, I think it was, but is it, are these problems still as bad as when you started?
We, we continued doing the audit and getting up to speed on information as we started writing and drafting, and at some point we have to kind of stop and say, okay, we can't keep gathering information. We got to start, concluding and writing. But they have done some work because we were, telling them the findings as we went along. The management section, the first part of the audit, we do more of a historical. We're showing a lot of issues that have happened, but they are all still affecting the foster care system currently. To answer your question.
When I've talked with people in Southern Oregon, particularly in Jackson County, one of their frustrations is with, quote, Salem. Did you see that a lot, that there's a disconnect between people in the field and management in Salem?
We did hear that a lot, and I think it was a result of the lot of organizational change that has occurred, particularly after the Give Us This Day scandal that happened. There was a lot of upper leadership that had left. They had dissolved the field offices unit that was the liaison between the central office and the field offices, and there were a lot of field offices and caseworkers and folks out in these communities that felt disconnected from what the central management was directing or saying and what they have to do day to day. That's why it's important that the DHS director and the child welfare director are going around the state to just hear people. We found people just wanting to be heard and understand what they're going through and talk. And it was extremely important for us as the audit team to just watch them in their work and understand the emotional toll and the stress that these caseworkers do. They are doing an incredible job, and they usually get the brunt of things when things do go wrong. And I just found it truly inspiring at the passion that they really do have. We left at 5 o'clock at the end of the day, didn't get any lunch because they worked through their lunch hour, and the next day when we reported back, we asked when they left, and they didn't leave till 8, 9 o'clock that night because children came into their care, and they have to do something about it.
Can I ask just a quick clerical? So how long did you take to put this audit together? How long were you working on it?
We started in January of last year. It took an entire year, and we feel confident with that because this was a big, massive problem. So if we would have gone in and done a quick audit in 4 or 5 months, we wouldn't have hit on all the issues that we were able to cover, that we feel like we got to the root causes of this.
Obviously, this is not an audit we want just to be placed on a shelf. This is about a baseline for the new leadership and for the people and their elected officials to realize this cannot continue, that we must draw the line now, make the changes necessary, allocate the funds, do whatever's necessary to help ensure that our most vulnerable population, these children, have the care and the services that they need, which requires caseworkers to have the numbers and the tools that they need to be able to do their jobs.
You said there were 770 open positions.
No, those are additional positions needed.
Okay,
Yeah.
needed.
They're not
Thank you.
they're
That's
not
what
currently approved.
Okay. You mentioned issues in various parts of the state, such as Southern Oregon. There are some particular issues. What about other parts of the state? Are there particular issues, for example, in Central Oregon?
Yeah, our audit team visited Central Oregon as well, and they were also struggling with placement options and hoteling, and they actually started having some hotels turn them away because they had been using them so often, and struggling to find enough foster homes to put the children in, or taking them out of, for instance, Prineville, and having to shuffle them to Bend. So they're out of their community, out of their schools. We also found some of the remote areas are struggling to find caseworkers in general. They have a hard time recruiting and getting people to even apply for the job. Every part of the state has their own kind of unique issues, and some are the same.
Alabama has done quite a bit in regard to this in the past. Utah has done quite a bit. Texas has done quite a bit about this. And so I guess this is a political question for the Secretary. A lot of states that might be seen as red states, more conservative states, have tackled this much more successfully than liberal Oregon. Do you have any insights into that?
Absolutely not. I don't know. I'm not a red or a blue person. I'm Secretary of State. My focus is on what can we learn from other states, regardless of what their political basis is, that would be valuable to implement here. We're looking for best practices. And so part of the recommendations that we give refer to that. For instance, one of the states, it uses GPS kind of systems to locate where their foster care families are located, where the foster homes are, and have data that indicates where there's vacancies. In Oregon, you have situations where a caseworker is sending out an email across the state saying, I've got this child that needs to be placed. Does anybody have a home? That is not an effective way to manage and to use data that should be there in a way to provide access for solutions as they come up and as they're needed by caseworkers.
This is, I think, is my last question, and that is, are there enough available caseworkers in Oregon, being trained in Oregon, or what does Oregon need to do to, because it is a tough, incredibly difficult job, what does Oregon need to do to get more caseworkers?
It's a factor of a number of things. There are people who are prepared to be caseworkers if the training is there, if the amount of money to pay them is there, if they felt comfortable that this is a position where they can make a difference. We have young people coming out of college with a degree in social work that want to dedicate their lives to making a difference in society. They get hired, they become a caseworker, supposed to have 18 months of training, they get much less than that, and they're finding themselves in a position of having to make a decision. Do I pull this child and disrupt this family in a horrible way, or do we leave the child in the position with the family and risk that there's going to be a problem, with violence? Either way, it's an untenable situation that they're in. They often don't have children of their own. They don't have a lot of life experiences, and they're being forced to make decisions they're not prepared to make, and that's part of the stress that they feel. Yes.
Do you know why there's been a diminishment of foster parents of the kind that you would like to see? Is it lack of support? Is it that perhaps the newer generations don't have the same idealism or maybe contributory nature? Do you have any?
I think it's all of the above. I think it has to do with, when foster care was first implemented, honestly, we had, usually one person working and one staying at home. It was a lot more convenient to be able to take on children and care for them. We've had high costs of daycare. Oregon's one of the highest in the nation for daycare costs. So if you have two working parents, it's incredibly hard to take on children, especially multiple children. Also, we've gone towards a model which we agree with, and that is that children do better with relatives than they do with someone else, and that's appropriate. But you still have those families that are children that don't have any relatives that would be able to take the children. So you need that base of individuals that can just constantly take in children. That you can rely on that as the backbone of the foster care system. And then also, we don't have a foster care recruiting and retention strategy in our state. And like the Secretary was saying, we have a lot of other states that are doing more with this. They're using GPS to map out where foster parents are. They know which homes have capacity, which homes have availability. Oregon has none of that.
As far as the last part of your question, I don't think it has to do with the age. Certainly, as Jamie has said, there's an issue with the ability to take in children. But we have in our own executive staff a young family. They just have had their own first baby, and they've taken in a 7-year-old, very needs-heavy foster child, and they're working to help this 7-year-old who's been bounced from care, from child foster home to foster home, from school to school, to have some stability. And this morning I was talking with another member of our staff in the Secretary of State's office. They have 2 young children, and they've taken in as a foster son a 17-year-old. And at 17, it's pretty difficult to find a home that will let them come in. And so I believe it's a factor of people not understanding the need. Not everyone can be foster parents, but a whole lot of people could if they knew, one, of the need, and 2, that there was a way to get into the system and to be certified that wasn't going to be so burdensome that it just wasn't worth it. I talked to a young family a few months ago about this very thing. They said, we tried, and then we saw what we had to do to qualify. I mean, we are not criminals. And we just said, you know what, it's not worth it. We're not going to do it. And so it's the new leadership is looking at how you can have the balance to make certification a reasonable approach that can be done in a reasonable amount of time and still not do anything to jeopardize the safety of the children that are going to be going to that home.
There have been a number of instances where people turned out not to be good foster parents and committed horrible things to kids. Did you find examples of a better system for vetting or certifying or things like that? Because you're having to balance the two things.
Honestly, we did not. We didn't specifically find that in any other state that had a better way of doing that. Oregon's got a very robust, comprehensive assessment that they do in a safe home study. And like the Secretary was saying, sometimes they may go too invasive. It's a pretty cumbersome, burdensome process. But I think you're always going to have some of those risks where it's unfortunate.
Mm-hmm. And when it happens, those make the papers. You know, it's never. There's 7,600 kids in foster care, and in this situation, this child suffered a major problem, and have it be put in perspective. As long as we're doing the best that we can, there will be. There's every effort being made to ensure the safety, but it's like taking kids in a car. You know, if you want 100% safety, don't put your children in a car, because there are car accidents. And so it's up to the child welfare system to learn the best ways, utilizing current technology and the availability of information that we didn't even have even a decade ago, to help with the evaluation, but to streamline it so that we can have the number of foster homes that we need, that are prepared, that are willing, and that are a safe place for our foster children.
So it sounds like the bottom line is for them to get into the 21st century in many ways.
Absolutely. When we're talking about ORCIDS, this data system that Jamie mentioned, we spent $76 million, double what was estimated, for a system that has never worked, has 1,000 fixes that are needed, and I mean, it's never going to happen. It's fatally flawed, in my estimation, and having been through a number of failed IT projects. There comes a time when you say, guess what? This Band-Aid that we keep putting on is not going to fix this cancer. This system needs to be replaced. I believe that's the case. I'm not an auditor, and so I can say that, but they stay just with the facts. But I think you need to draw conclusions. If something's not working, you know, if the hole is in the wrong place, quit digging and go to where you can have the resources that you need, learn from other systems on what's working, and make the changes that are necessary. Let me close with one thought. I was in legislature when our mental health state hospital our state mental health hospital was not functioning. We had patients there that had no treatment plan, that were just being warehoused, and they didn't have enough staffing. And finally, a federal judge got involved, and not just the federal judge, but also the Senate president, and something had to be done. We now have an exemplary state mental hospital in the way that it's functioning. It was very expensive. Before this was done, we didn't have the money to address it. It went on decades and didn't get addressed, but it got addressed because it had to. And so I believe that Oregon faces a crossroads. Either it can take responsibility to bring about the changes and come up with the solutions and start implementing them now, or we go along, continue to harm children, and lose caseworkers, and lose foster families because of lack of support and training, until a federal judge orders us to face up to this problem and fix it. I say we should do the former. Thank you all so much for being here and being a part of getting the word out. Please read the audit and become an advocate for changing the system. Thank you.